China's zero-COVID policy has drawn criticism ranging from scientists to its own citizens. In cities like Shanghai, Beijing and others, anti-COVID-19 measures have been very strict, with residents not allowed out of their homes only for exceptional reasons like medical emergencies. Many are not even allowed to mingle with their neighbors. The World Health Organization says it does support countries' measures to limit the spread of the pandemic.
As you know, as the World Health Organization, we're working with all nations, all countries, everyone, everywhere on COVID. From China's perspective, this dynamic COVID policy that they're following is their attempt to try to control transmission of COVID-19. Many countries have chosen different types of policies related to this pandemic from the beginning and throughout, and our responsibility is to ensure that we provide the best advice.
But the WHO chief says zero-COVID policy is not sustainable. This has not been well received in Beijing.
When we talk about the zero COVID strategy, we don't think that it's sustainable considering the behavior of the virus now and what we anticipate in the future. And especially when we have now a good knowledge, understanding of the virus, and when we have good tools to use, transiting into another strategy will be very important. We have discussed about this issue with Chinese experts, and we indicated that the approach, will not be sustainable.
You need dynamic and adjustable, agile policy. One of our problems, if we go back to the beginning of this pandemic, was a lack of agility in many places that resulted in a lot of harm. It is important to reflect on the fact that China's only had just over 15,000 deaths during the whole pandemic. So in that sense, China had something to protect. And certainly over the last, since February, March, there was a rapid rise in deaths. So therefore, any government in that situation will take action to try and combat that. But all of those actions, as we've said since the beginning, should show due respect to individual and human rights.
The WHO head says the international community needs strong leadership with a number of challenges arising across the globe.
You have the health crisis, which is global. You have the food crisis and inflation and so on because of the conflict. You have the energy crisis. You have the migration crisis. And there is also the climate crisis. I think a convergence of all these crises same time is very, very dangerous for the world.
Meanwhile, the World Health Body says the worst-case scenarios for COVID-19 include a variant that evades current immunity, transmits more easily and causes greater mortality. South African scientists have urged further vaccination as key to mitigating the next wave of COVID-19. Khayelihle Khumalo, SABC News, Johannesburg.